I could clarify some of the concerns that I found when I was looking at your online exam, as well as just one item from your in-class exam as we move forward in the course. So the first thing that I wanted to talk about is body weight, converting body weight. It's important that when you are calculating an infant's body weight that has ounces associated with it, that you take care of those ounces separately from the pounds to do your calculation. So we need to convert the ounces. And in this example, this baby weighs 10 pounds, 2 ounces, and this can be found in Module 25, page 6, and it's the example problem number 3. To convert the ounces to pounds, you need to divide the ounces by 16 ounces, which is the number of ounces in a pound. When you do that, you can see on this example that it becomes 0.125. The important thing to note here is they round at this point. I talked about this to our Tuesday class, but I didn't get a chance to talk to the Monday group about this. So you do round in the middle of the problem. This is a deviation from our normal rounding rules in mathematics. The second step is to take this calculation, which has been rounded to the nearest tenth, 0.1, and add it to the total number of pounds down here, and you see that it's 10.1. Now you do your conversion from pounds to kilos by dividing it by 2.2, and you see here that the answer has become 4.59. It is once again rounded to 4.6. This is now the calculation that you will use to plug into the formula when you're calculating a drug dosage for, in this case, we're going to be dealing with it with pediatric patients. So I encourage you to review this and to use this in calculating the answers for your problems on this test and in the future. So the next thing I want to go over is time and frequency. It's important that you realize that time and frequency are not necessarily exactly the same thing. I know they're combined in one paragraph in your textbook, and it makes it look like it's the same thing, and you can interchange those two words, but that is not true. Time is when a medication is specifically given. This is not required for a legally written order. Here is an example of what that would look like. Give 1 gram of Ansef at 2 p.m. You can receive an order like this, but this is not typical and is not required. You do need time in which the order was written, and you need the date, but not the time the medication specifically needs to be ordered. What you must have is the frequency, or how often does the medication need to be repeatedly administered over time. An example of what that order would look like would be this. Give Ansef 500 milligrams IV piggyback every 6 hours. You see, we don't have a time in which we begin the medication or the specific times in which it must be administered, but we have the frequency in which the medication is to be administered. And so you could say, okay, that is the times it needs to be, but not literally. That's not the times on the clock. It's the frequency. So in a legally written order, you must have the frequency, and time is sometimes included in an order, but is not required. Moving on to the next item, computing the quantities. It's important when you are looking at computing the quantities or how long will a medication last, you must know that practice differs between a healthcare facility and home use. If a medication is not totally consumed, it's considered wasted. We must, whatever remaining portion we have to throw it away. Because many medications come to us in what's called unit dosing, and this is an example of the medication that you see on the screen. This medication comes to us with 30 milliliters, and what is each of the drugs that are in there that make milk of magnesia, which is what this is, but the quantity is 30 mLs. In our example child on the screen, you're going to see that this 6-year-old needs to have 15 mLs orally once a day as a laxative. I hope not forever. And you can see that if you use this unit dose, you would need to waste half of this cup of medication. If you used it at home, you might save it and use it for another dose, but you cannot do that in a healthcare facility. So anytime you only use a portion of the medication that comes unit dosed, you drop it on the floor, or specifically if you're giving, or you go to the room and the patient refuses the medication, you've already drawn it up. Too bad, so sad, you're going to have to throw it in the trash. And in that case, specifically with narcotics, you're going to have to document what happened to the rest of that narcotic, and it will have to be co-signed by another nurse. In the case of a refusal by the patient, you still have to document in the patient's medical record that they refused their medication, and if there's a reason for the refusal. So going on to reading a label, there's a few things that I want to make sure that you're very clear about. There is a difference between the name and the form of the medication, even though it may be listed on the label side by side. So the trade name in this case is Diflucan. And this is always capitalized. The generic name is fluconazole. Fluconazole is an antifungal medication. And in this case, you can see that fluconazole has the word injection next to it, but this is the form of the medication. It is sterile solution. It's for injection. It is not part of the name per se, but it is the form that the medication is in, because Diflucan can actually be given orally. So it's important to know that this is not to be given orally. This is for IV administration. So you need to make sure that you're aware of that information. I was looking on this label. I don't see USP clearly on this label, but it is on others. And so I wanted to make sure that you realize that USP is not part of the generic name either. USP is actually an organization which sets standards for the identity, strength, quantity, and purity of our medications, food ingredients, and our dietary supplements. So it doesn't go as a part of the generic name either. What should you know? Well, definitely you need to know the rights of giving medications, such as the right patient, the right dose, the right time, etc. You need to know how to read a label so that you fully understand the different parts of the label. What is legally required for every provider order? And I went over that information with you. How to calculate an ordered medication from a provider order. You're going to get more practice when you're working your problems in Module 17. You're going to see Module 17, you're going to be doing lots of calculations. So by doing that module and those quizzes, you're going to be able to get more and more practice. But I certainly encourage you to use the end of the chapter review questions. And when you're working through your modules, I want to make sure that you are taking the time and working through those practice problems throughout a module. Don't just rush through the lesson and get to the quiz and check it off the list, because you're not giving yourself adequate opportunities to learn the material. So one more time, practice, practice, practice. If you have further questions or need clarifications, please email me. Thank you.